Here's Jeffrey. Like more than 600,000 US citizens, Jeffrey suffers from liver cirrhosis, a severe chronic disease that impairs his liver function. If not managed, liver cirrhosis progresses to an irreversible state. Notably, 7 of 10 people that suffer from this disease are not aware about it. He understands that he needs to take special care of himself, as 30% patients with ACLF need rehospitalization within 30 days. It may have been the drink he had, a bacteria in his steak, or a virus in the air he breathed. He suddenly starts to feel dizzy and weak. Nausea develops and gets stronger. Without knowing what is happening to him, he begins to vomit. It is blood, a lot of blood. After that, he can't remember anything. Lucky for him, his family insists to bring him to the nearest hospital. Jeffrey doesn't realize it, but each minute counts from now. A few hours have passed, and Jeffrey has been diagnosed with variceal bleeding, a type of acute liver decompensation that is life-threatening. Consequently, he was sent to ICU following emergency treatment of the bleed. The doctors and nurses on the ICU cannot talk with Jeffrey, as he is very sleepy and disoriented, a condition also called hepatic encephalopathy that frequently occurs following variceal bleeding. The doctors also find a urinary tract infection, and Jeffrey's kidneys start to fail. Jeffrey has developed acute on chronic liver failure, a condition with high short-term mortality for which no approved treatment exists. His care team can only do their best with supportive treatment while his relatives hope he will recover. Luckily, receiving the best hospital care and loving support of his family, Jeffrey recovered and was transferred to the ward after 3 days on ICU. After another 2 weeks of care, he stabilized and was able to go home. He understands that he needs to take special care of himself, as 30% of patients with ACLF need rehospitalization within 30 days. Unlike Jeffrey, many patients with ACLF are not as lucky, leaving their care teams and relatives powerless, and their beloved ones hopeless. It is highly critical that an efficient treatment is identified from which patients like Jeffrey may benefit. Even more so considering that the number of ACLF cases has been multiplied by 4 since 2011 and is set to continue to increase. By exploring multiple pathways targeting different mechanisms of action, GenFit is working on developing treatments for patients with ACLF to increase the chance of recovery, stabilize the patient, and allow for liver transplantation as the ultimate cure.